Good morning. My name is Dr. Thomas Collins. I am one of the emergency medicine faculty in the Department of Emergency Medicine here at MetroHealth. I'll give you a brief statement regarding the victims of the house explosion on the southeast side of Cleveland this morning. Shortly before 9 a.m., the emergency department at MetroHealth began receiving victims from a house explosion on the southeast side of Cleveland. They received a total of 11 patients, 6 adults, and 5 children. These patients appear to have relatively minor injuries, none of which will require admission to the hospital. There are a number of patients that have multiple lacerations, bruises, contusions, and a number of patients with abrasions. They are all in the process of being evaluated. Some have been discharged already. They have a lot of family reaching out and supporting them right now. Our social service department right here at MetroHealth is involved with the Red Cross and other community agencies getting support for the family. We are very fortunate that what we've seen so far today, even though it involves a relatively large number of people, their injuries are minor and they will recover fully from their injuries.
Yes. Doctor, where, based on the extent of the injuries, where were these people based in relation to the explosion then?
They were in a house next door to the house that exploded. That's our current understanding. And they were distributed in multiple levels of that house.
All 11 were in the same house?
I don't know if all 11 were in the same house. I'm told they were in the house. They were in houses surrounding the explosion.
Do you have approximate ages for the children and the adults? Is there any ages you share?
I don't have all their ages with me. The children are school-age children, ranging to high school-age children.
Have you been able to talk to them, Doctor? What have they described what happened? I'm sure it happened so quickly they didn't have a chance to really think about what happened. Have they talked to you at all about it?
The patients that I cared for personally were all very well composed. They were very concerned about each other, friends, and other family members. They described a loud explosion and then being concerned about everybody else.
What was needed to be done by Metro in advance of these patients coming in? Obviously, you knew you had a large number. What does your team have to do then in preparation of those patients coming?
The ability to ramp up and respond to critical events is one of the things that we are somewhat practiced in here at MetroHealth. To be able to intake 11 injured patients quickly is something that occurs with relative frequency here. The physician and excellent nursing staff organized to greet the patients when they came in, assess if anybody had immediate injuries that needed immediate attention, and then begin our process of more thorough evaluation and wound care. During this process, we still had other patients that came in that needed emergency care that had no delay in their care. So it was handled relatively normally. Everybody was seen very quickly.
Were the lacerations from cut glass and things like that?
The injuries were from falling objects as well as glass.